You're still listening to your favorite dial right here on Radio Global, and it's another beautiful and wonderful time right here with you on the Happy Baby Show. On the Happy Baby Show today, I have a lovely guest right here in the studio, and her name is Dr. Eunice Edemaria. She's right here in the studio, and we're going to be talking about something which I believe will interest all of you mothers out there and also caregivers in general. It is concerning autism. So don't go nowhere. It's still Radio Global where we are redefining your radio experience. Stay with us. Oh baby, oh baby, oh baby, oh baby. You're still listening to your favorite dial right here on radio. It is Radio Global, and the program you're listening to right now is the Happy Baby Show. Mrs. Eunice, that is Dr. Eunice, is right here in the studio, Dr. Eunice Edemaria, and she's going to be telling us some things that we need to know about autism. Hello, Ma, how do you do today?
Very well, thank you.
It's a pleasure. It's nice having you today on the program.
Thanks for having me.
All right. So we're going to be looking at autism now. But before I ask you questions concerning autism, first of all, I would like to know. Yes, I know people out there would like to know some things about you, since you're a doctor who has come here to talk to us about autism.
Okay, you said my name already, Eunice Edemaria. I'm a senior medical officer. I work with Dorin Specialist Hospital in Ajah, Lagos, Nigeria.
Right. Okay. So now we want to go over to what we'll be discussing today. It's on autism. So what do you think autism is, or what do you see autism as?
Autism is a developmental disorder. It's a neurodevelopmental disorder. In simple terms, it means there's a problem with the development of a child that results from a problem in the brain.
Right. Okay. So it's a problem with the brain now.
Basically.
Okay. So what really causes it? Did the child just maybe bring it from the mother's womb, or did the child just? I know people out there or mothers out there won't quite understand. So I don't know if you can give a good explanation.
Yeah. The actual cause of autism is not well known, but there are so many theories. But what research has shown is that it has a strong genetic basis, meaning something goes wrong in the gene of the child that will not translate into a problem in the brain and then comes out as a problem with development. And when we talk about development, we talk of common things like at a certain age, from like 6 weeks, a child should be able to smile when he or she sees a familiar face. At a certain age, a child should be able to say one or two words, should be able to make sounds and all that, okay. Or just talk generally. So if a child is not able to talk at the time the child is supposed to talk, it means there's a problem with the development of the child, and that's what we are talking about.
Autism, all right. And why do you think that, or how do you think a parent will be able to find out if his or her child has autism? Because I don't believe it's something that can be seen on the face. So how does a parent tend to identify or know that the child has autism?
Yes, rightly so. Like what you said, a child with autism, if he or she is sitting quietly, you will not know that there is any problem with the child, because of that, autism is sometimes referred to as an unseen disability. Mm-hmm. But autism is characterized by 3 major features, and that is where we teach people to observe their child in those aspects. The first one is there is impairment of social interaction. Like you see a familiar face, you want to smile, you wave, Those are social gestures, social interactions. The child has impairment in those areas, so the child cannot play with you. The child cannot just, when you see somebody you lighten up. The child, no, they don't have that ability. That's one. Two is there's impairment of communication, both verbal and non-verbal. So most children with autism, they will not talk, even at age 3, at age 4, at age 5, and the parents will be wondering what is the problem. So communication. Then the third one is they have this way of restricting themselves. They stick to what they know, and then they have this repetitive behavior. The child will keep doing one thing over and over and over. So if the parents are observant, they will know definitely that something is wrong with the child. For example, if a 3-year-old child cannot say a sentence, or let's take down the bar, say a word or two at 3, the parents should know that something is definitely wrong and they should seek help.
Wow. Oh, seriously, because I know a whole lot of mothers out there will have this find out that their child has or that their children have this certain kind of problem, and they'll be wondering, where did they come from? Was it somebody who did something to my child from home or something?
Yes.
Seriously, because it's not something that you can really see on the face. Okay, we're still talking autism right here on the Happy Baby Show, and Dr. Eunice is right here, and she's been telling us some things that you will need to know concerning autism. We're going to take a short break, and when we come back, we'll talk more about autism. Stay with us.
He's uncomfortable somewhere, and I don't know what it is. I'm really disturbed.
Got baby issues? You want to know the best way to take care of your baby? Listen to the Happy Baby Show on Radio Global for new and old parents and from parents to be.
You got a body like a nail brush, but I can give it to you all the time. Oh baby, oh baby, oh baby. When I wake up in the morning, I see your lovely face. Your cheeks like butter, honey from a teacup. You take my breath away. Your pretty little fingers so tender, like petals from the morning dew. Your laughter a joy to remember. Heaven has blessed me with you. The very day you gave to me, my whole life became brand new. Because of you. Oh baby, I see me in your eyes. Oh baby, I see love in your smile. You tell me, Gucci, yeah, I understand. You tell me, Gucci, yeah. Oh baby, oh baby, oh baby, oh baby. Oh baby, my baby. Oh baby, in the middle of the night I wake up. When I hear you cry, it seems something binds us together. Supernatural, I can hardly live a moment without you. Because of you. Oh baby, I see me in your eyes. Oh baby, I see love in your smile. You tell me, Gucci, yeah, I understand. You tell me, Gucci, yeah.
You're still listening to Radio Global, where we are redefining your radio experience. We're still talking with Dr. Eunice Maria, and she's a senior specialist, am I correct?
Senior medical officer.
Yes, senior medical officer. Yes, and she's right here in the studio, and she's been talking to us about autism. So we would like to find out from Dr. Eunice right here if there are types of autism.
Well, we say that autism is a spectrum disorder, meaning you have different forms. Commonly, there are three disorders in that. We say autism spectrum disorder. There are three disorders. Autism is one. The other one is Asperger syndrome. It's very like autism, maybe one or two differences. And then the other one is pervasive developmental disorder. So they look alike. The difference between the typical autism and Asperger is that in Asperger's syndrome, you don't have much of the communication problem. A child with Asperger's syndrome could actually talk normally. And then for the third one, the pervasive developmental disorder, is if the child looks like autism but does not meet all the criteria, the three core criteria, you will not say is pervasive. Then in terms of spectrum, the severity of autism varies widely from a mild form to a moderately severe form and then a severe form. So there are some children or adults with autism, and we say they are high functioning, meaning they can almost perform close to their normal peers. Yes.
Right. So now talking about autism in itself, you were saying some certain things just now, talking about the spectrum and the other ones. So is it that just merely seeing a child who might have a smiley face and other things like that, but the child might still have autism? But how would you know when a child who is smiling and still looking like a child that has, or a child that is full of life? How would the parents still find out if autism still is in that child?
Well, you can, as a parent or as a primary caregiver, you can only suspect. Once you have a suspicion, you should seek help. You should go to the specialist and get your child examined so that a diagnosis can be made.
Okay. So what tests now should a parent take the child for if autism has been seen to be in that child?
Okay, if a parent or a primary caregiver suspects that there might be something wrong with this child at 3 is not talking, this child does not interact with people, at 18, 20, 22 months, this child does not babble, does not wave, does not point, common things toddlers do, imitation, play with friends. If you have a suspicion, you can start by taking the child to a GP, general practitioner. And then if the doctor is convinced that something is wrong, it might be referred to a pediatrician, and then finally to a pediatric neurologist or a child psychiatrist, the specialist, and then they can get the child examined properly.
Okay. So now, is therapy one of those things which could be recommended for a child who has autism?
Therapy is the main thing. Therapy is the main thing. The child needs help.
But really, isn't sorry to cut you short there, would the child be too young for things like therapy?
Well, there are different forms of therapy. For children less than 3, most of the therapy they do is in-home family-based therapies. But for children 3 and above, yes, most of them do school programs in combination with in-home and family-based therapy.
Alright, you're still listening to the Happy Baby Show, and Dr. Eunice has told us a whole lot about autism. So if you're a mother out there, you're a father out there, and you love your child so much, you love your baby so much, please be on the watch and on the alert to find out if your child might be having traces of autism. So talking about therapy as being something that could be done, is there any other thing a parent can do to help a child with autism?
Yes. The first is, if the diagnosis has been made that your child could probably have autism or something like autism, you should learn about the disorder. Because if you know the problems involved, the deficit the child have, and you know why, you'll be able to understand the child's behavior. Because truth is, it's very demanding caring for an autistic child. It's very demanding because sometimes they display abnormal behaviors. Sometimes the behaviors can be self-injurious, meaning they can harm themselves. And some of them, at the time when they are supposed to have like toilet control, they cannot. So it's a whole lot of burden.
Toilet control?
Yes. So it can be quite challenging, but if you understand the inherent problems, you'll be able to deal with them, and you'll be able to be tolerant of the child.
Okay, because a whole lot of parents, okay, I'll use mothers as an example now. Some certain mothers will be like, why is this child acting like this? Or I can't take this, I can't take that. Not as if they can't care for that child, but they believe that, okay, they don't have an understanding of autism. So now you're trying to say that even mothers should learn, they should study
Definitely
autism. Okay, so Dr. Eunice is still right here in the studio. That's Dr. Eunice Edemaria, and we're talking about the issue right here, which is autism. So we hope you've been able to learn a whole lot. We'll take a short break, and when we come back, we'll talk more. Stay with us.
From a seeker, take my breath away. Your pretty little fingers so tender, like petals from the morning dew. Your laughter a joy to remember. Heaven has blessed me with you. The very day you gave to me, my whole life became brand new. Because of you. Oh baby, I see me in your eyes. Oh baby, I see love in your smile. You tell me, Gucci, yeah, I understand. You tell me, Gucci, yeah. Oh baby, oh baby, supernatural. I can hardly live a moment without you, because of you. Oh baby, I see me in your eyes. Oh baby, I see love in your smile.
You're still on to Radio Global, where we are redefining your radio experience. I still have Dr. Eunice Edemaria. She's right here in the studio with us, and we're talking about autism. So, off air, myself and the doctor right here, we're trying to mention some certain things that have to do with even autism in grown-ups. So not just in babies alone. So I don't know if you can just explain that to our listener out there who would really want to learn more about that.
Yeah, there are adults that are autistic. Of course, the autistic child will grow up to become an adult. It is actually more challenging because most adults that are autistic still live with their parents. They are not independent because there are so many things we haven't said about autism. We only talk about the 3 core features: so impaired social interaction, communication problems, and restrictive and repetitive behavior. But autism also comes with many other problems. Some of them are psychiatric. For example, some people with autism cannot hear, they have hearing problem. Some of them cannot see very well. Some of them have depression. Most of them have depression. Most of them also have anxiety disorders, and in children, ADHD, hyperactive children. So they need therapy so that you can try to alleviate those symptoms and you can improve their ability to take care of themselves, because when they grow up to become adults, how much therapy the person has had influences a lot in terms of self-care and independence.
Okay, so lastly, we're going to be looking at medications now. The medication side of it, we've talked about therapy. So, is there any medication that this child can be given?
Okay, when we talk about therapy for autism, it's more of psychotherapy, behavioral therapy because they commonly have speech problem, speech therapy, occupational therapy to increase motor skills and to maybe help them learn a skill that might help them in the future. Well, in terms of drugs, once in a while, but it's not a common feature. For example, for those that have that are hyperactive or that have anxiety or that have sleep problems, yes, the specialist could put them on some medication, especially for children, to calm them down. But it's the mainstay, it's therapy, behavioral therapy, speech therapy, occupational therapy, and the like.
All right. Okay, talking about food now, does food have anything to do with autism at all?
Okay, well, we've said that the problem in autism mainly is a genetic problem, and then you also have some environmental factors affecting, and it is said that the damage happens very early on in life when the woman is pregnant with the baby, and we're talking of before 8 weeks, from the very early days, early week to about 8 weeks. And that's a very sensitive period. We call it embryogenic period, when the brain is being formed, the body parts are being formed. So we as doctors, we generally say that when you are pregnant, especially the first 2 months, eat healthy. Don't eat too much refined sugars, don't eat too much processed food, just eat healthy, stay away from drugs, whether prescription medications or non-prescription medications, stay away from cigarettes, stay away from alcohol, chemical areas, because that is the time that anything that is going to affect the child will likely affect the child.
Well, we've been talking to Dr. Eunice Maria, and she has told us a whole lot about autism. So for mothers out there, if you're a caregiver, you are a father, really, at least you've been able to learn a whole lot about autism. So thank you very much, doctor, for being with us right here on the program.
Thank you for having me.
Alright, and we hope that when we call you some other time, you'll be able to come.
Why not?
Alright, you're still listening to the Happy Baby Show, but this is where we're going to call it a wrap. So till we come your way, same time, same place, I'm Yvonne Richards, and I'm signing out saying bye-bye.
Oh baby, my baby. Oh my baby, baby. You make me cry. Laughter is not enough. I've seen true beauty because I see you. Oh baby, oh baby. na, come on. I like it. Na, 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 come on. I like it. Na, 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 come on. I like it. Na, 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 come on. Na, 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 na. It's so good being bad.